everybody, welcome to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a blood pressure medication known as Lisinopril or Zestril. So Lisinopril is classified as an ACE inhibitor or angiotensin converting enzyme inhibitor. We do see it used often in congestive heart failure as well as post-heart attack in individuals who are stable. In terms of official indications, it is typically seen being used to treat essential hypertension. It's also used in renovascular hypertension as well. We mentioned earlier that it was used after a heart attack, and it is used in this situation even if the individual using the medication does not have high blood pressure. That's because studies have shown that ACE inhibitors, such as Lisinopril, are actually shown to increase survival in patients who have suffered a heart attack. So how do ACE inhibitors work? Well, ACE, or angiotensin converting enzyme, is the enzyme that converts angiotensin 1 to angiotensin 2. By inhibiting this enzyme, we decrease the amount of angiotensin 2 in the body. This causes an increase in renin, which leads to a decrease in aldosterone secretion. Now, before somebody was to use Lisinopril, there are some indications that they should make sure don't apply to them. So it's contraindicated in any individual who is hypersensitive to a part of the product. If an individual has a known allergy to any ACE inhibitor, they're probably not going to use Lisinopril. They're also contraindicated in individuals who have had angiourotic edema following the use of another ACE inhibitor. Also, if somebody has hereditary idiopathic angiourotic edema, they should also stay away from this medication. There are also some precautions that should be considered before starting the medication. Following an acute myocardial infarction or a heart attack, individuals should not use this medication if they have suspected renal insufficiency. This can be considered a serum creatinine level of over 177 micromoles per liter, or proteinuria exceeding 500 milligrams in 24 hours. If an individual has compromised renal function and they use this medication alongside of long-term NSAIDs or non-steroidal anti-inflammatory medication, they could see an increase in renal dysfunction. It's always important as well to keep your appointments for blood work when you're using this medication because your physician needs to monitor certain parameters to make sure that your liver and kidneys are up to par. So in terms of dosing of this medication, we'll start by saying that it is dependent on how your blood pressure reacts to the medication. Some people may use a lower dose than others based on the response they get with their blood pressure. Because this medication does not interact with food, it can be taken before, during, or after meals. The usual range is anywhere from 10 milligrams to 40 milligrams taken once a day. Now, there can be a little bit of a drop-off of the antihypertensive effect near the end of a dosing interval, so right before you take your next dose, but this is typically more commonly seen with the 10 milligram dose. For individuals with renal impairment, there should be a dose adjustment made. If the creatinine clearance is between 31 and 70 mils per min, then a starting dose of 5 milligrams to 10 milligrams can be used. If the creatinine clearance is between 10 and 30 mils per min, then a starting dose of 2.5 to 5 milligrams is appropriate. Individuals with a creatinine clearance less than 10 mils per min who require this therapy, who cannot stop it, must start at a dose of 2.5 milligrams. During the initial phase of therapy, it can take a little bit of time to get your blood pressure under control as you have to work your way up to the dose that works for you. Just follow the advice of your physician and pharmacist and work towards getting to that point. Now, after an individual is using this medication, there are some side effects that they could experience. I'll list some of them for you now. Chills, fever, and abdominal pain have been experienced by some people. 6% of people can experience some hypotension, so low blood pressure with the medication. Nausea, vomiting, and diarrhea have occurred. Some people experience angioedema or peripheral edema. Rarely, some people can experience some joint or muscle pain. And insomnia can happen sometimes as well. There are many other side effects that can occur, less than 5% of the time. So we're going to leave these out of these videos just so I don't throw too many side effects at you. But they can be found on the drug monograph. That's all I have to say today about Lisinopril. As always, just keep in mind that this channel is used for information purposes only, and don't use this channel for any personal healthcare advice. If you have any questions about the medication that we cover, just ask your personal healthcare provider, so your physician or your pharmacist. All right, that's it for today. Take care.